So what exactly is a brain or cerebral aneurysm?
So basically, this is a nice 3D image of the blood vessels, the arteries that actually bring the blood to your brain, right? So the arteries, they have like high pressurized blood flow, right? Because the heart's pumping up under pressure, like the blood that goes to the rest of your body, including your brain. So you have here all the arteries, you know, when you rotate this here, you can see this is a look at your lateral, right? So this is the nose, these are the eyeballs here, and all this red stuff are the blood vessels, the arteries that go to your brain, okay? Now we have basically two types of circulation. One is the anterior circulation, which is these two very important vessels, the internal carotid arteries, that they go up to the brain and they bifurcate, give the anterior cerebral, middle cerebral arteries, and then the vessels in the back of your brain, which is the vertebral arteries, and then the basilar artery and the posterior cerebral artery. So an aneurysm can happen anywhere on those vessels. There are some places that are a little bit more common than others. The anterior circulation is more common. However, they can happen actually anywhere. Now, what is exactly an aneurysm? So you think about this tube, for example, here. You have the vessel here, right? The vessel is almost like a tube, a very regular, smooth tube where it has like branches that come off from it to go to supply the brain parenchyma. So think about a little area of weakness that happened on part of this tube. And then, you know, because of that pressure inside the blood vessel, that starts to bulge out and form a little sac inside the aneurysm. So imagine this here, the tube, and then would form like a little sac that would form here. You don't see it here. That would be the aneurysm. Okay, and then with time, that actually, you know, may continue to grow or may rupture even when they're small in size. So those are the most, those are the vessels, and that's where the aneurysms happen. Now, talking just quickly about the ischemic type too, because I think it's a nice way to show this. So the ischemic strokes that we need to treat with catheter are usually when vessels such as the internal carotid artery, like inside your brain, like here, or the middle cerebral artery, which are some of the most important vessels here, or sometimes the basilar artery, which is the vessel on the back here, they get blocked very more proximal, like not very distal here, because that's very difficult to reach there and to treat with the device that we have. But when it's more proximal here, which are the most important, the most dangerous ones, is when we put the devices there and remove the clot that is blocking this type of vessels.